Have you ever felt like something in your body just isn't working the way it used to, but you can't quite put your finger on it? What if I told you that some everyday medications could be quietly sabotaging your erections without you even realizing it? Hi, I'm Nora, and welcome to Heal Naturally, the channel where we explore simple, natural ways for men to reclaim their energy, focus, and vitality. Today, we're uncovering a surprising truth. Certain prescription drugs can harm your sexual performance. If you want to stay strong, confident, and fully in control of your health, make sure to subscribe, and let's get right into it. Let's start with the basics. Most men don't realize that erections aren't just about testosterone. They're about blood flow, nerve signaling, and hormone balance. When you take certain medications, even for completely unrelated issues, they can interfere with these natural processes. Think about blood pressure medications, for instance. Drugs like beta blockers are excellent for managing heart health, but they can sometimes reduce blood flow to the penis, making it harder to achieve or maintain an erection. It's not that your body is failing, it's that the medication is subtly limiting circulation. Another common culprit? Antidepressants, particularly SSRIs, which many men take for anxiety or depression. While these medications help stabilize mood, they can also blunt sexual desire and delay ejaculation. Many men feel embarrassed or confused when their libido drops, not realizing it's a side effect rather than a personal failing. Even medications for allergies, stomach issues, and prostate problems can play a role. Antihistamines, for example, dry out mucous membranes and can contribute to overall fatigue or lower sexual responsiveness. Meanwhile, drugs that affect hormones, like certain steroids or hormone-based treatments, can directly impact testosterone production, which is crucial for energy, mood, and sexual health. It's important to understand that these drugs don't destroy your body permanently. Instead, they create conditions that make natural erections more difficult. Recognizing this connection is the first step toward regaining control over your sexual health. Here's a simple rule. Any drug that impacts blood pressure, hormones, mood, or nerve signaling has the potential to interfere with erections. This doesn't mean you should stop taking your medications on your own. Always consult your doctor. But it does mean you should be aware and proactive. Now, let's talk about why many men never make this connection. Erectile issues are often attributed to stress, aging, or lack of exercise, which are valid contributors. But if you're diligent about diet, movement, and sleep, yet still notice changes, your medication could be the hidden factor. The good news? There are natural strategies that can help counteract these side effects. Simple lifestyle adjustments like optimizing blood flow through exercise, managing stress, and supporting hormone health with nutrition can make a significant difference. And in some cases, your doctor can adjust your prescription or dosage to reduce sexual side effects without compromising your overall health. Understanding the link between medications and erectile health is empowering. It shifts the narrative from feeling helpless to recognizing that there are practical steps you can take to regain control. Now that we understand how medications can subtly interfere with sexual health, let's get specific. Some drugs are more likely than others to affect erections, and knowing which ones these are can help you have an informed conversation with your doctor. 1. Blood pressure medications. High blood pressure is incredibly common, and managing it is essential for overall health. But certain drugs, particularly beta blockers like atenolol or metoprolol, can reduce blood flow to the penis. This doesn't mean you should stop taking them. Your heart health is critical. But pairing these medications with natural strategies, like daily exercise and nitric oxide boosting foods, think beets, spinach, and watermelon, can support blood circulation and help maintain sexual function. 2. Antidepressants. SSRIs, selective serotonin reuptake inhibitors, such as sertraline, fluoxetine, and paroxetine, are widely prescribed for depression and anxiety. While effective for mental health, they can blunt libido, reduce arousal, and delay ejaculation. Many men feel frustrated or embarrassed, thinking the problem is all in their head, when in reality, it's a known side effect. In some cases, switching to a different antidepressant or adjusting the dose under medical supervision can improve sexual function. 3. Medications for prostate and urinary issues. Men taking drugs for enlarged prostate, like tamsulosin or finasteride, may notice erectile changes. Tamsulosin can sometimes interfere with ejaculation, while finasteride, often used for hair loss, may lower testosterone slightly and impact libido in sensitive individuals. These effects are not universal, but are worth monitoring if you notice changes after starting treatment. 4. Painkillers and anti-inflammatory drugs. Opioid painkillers, such as codeine or oxycodone, can lower testosterone over time and reduce sexual desire. Even some long-term non-steroidal anti-inflammatory drugs can indirectly affect circulation and hormone balance. Again, this isn't a reason to avoid essential medications, but to be mindful of their cumulative effects on energy and sexual health. 5. Lifestyle and over-the-counter drugs. It's not only prescription drugs that matter. Over-the-counter medications like certain cold medicines, antihistamines, and even antacids can dry out the body, affect blood pressure, or influence nerve signaling. Alcohol, while not a medication, deserves mention here as it temporarily relaxes inhibition, but can also impair blood flow and sexual performance when consumed in excess. So what can you do if you're taking these drugs? Awareness is the first step. Track your symptoms and timing. Notice when changes in sexual performance occur relative to starting a new medication. Bring this information to your doctor. They may suggest alternatives, adjusted doses, or scheduling medications differently to reduce sexual side effects. Beyond medical adjustments, you can naturally counteract many of these effects. Exercise. Even 30 minutes of brisk walking or light strength training daily can improve blood flow and hormone balance. Nutrition. Foods rich in antioxidants, healthy fats, and nitric oxide boosters support circulation and hormone health. Stress management. Meditation, breathing exercises, and quality sleep reduce cortisol, a stress hormone that can suppress testosterone and libido. Supplements, with caution. Certain natural supplements like L-arginine, zinc, or vitamin D may support erectile function, but always check with your doctor, especially if you're on medications. Understanding which drugs are most likely to interfere with erections removes the guesswork. It's not about blame, it's about knowledge and taking small, manageable steps to maintain sexual vitality while staying on track with your overall health. Now that we've identified which drugs can affect erections, the most empowering step is knowing what you can do naturally to maintain sexual health. The key here is balance, supporting blood flow, hormone function, and mental wellness while respecting your current medical needs. 1. Prioritize blood flow. Erections are fundamentally about circulation. Even if a medication slightly limits blood flow, you can enhance it through lifestyle choices. Cardio exercise. Brisk walking, swimming, or cycling for at least 20 to 30 minutes daily improves vascular health and nitric oxide production, which relaxes blood vessels and boosts flow to the penis. Strength training. Building muscle helps regulate hormones like testosterone and improves overall energy, indirectly supporting sexual function. Stretching and yoga. These reduce tension, support circulation, and improve flexibility, which can make sexual activity more comfortable and confident. 2. Focus on hormone support naturally. Testosterone and other hormones play a central role in libido and performance. Some medications can slightly suppress hormones, but natural strategies can help maintain healthy levels. Sleep. Aim for 7 to 9 hours per night. Deep sleep is when your body produces the most testosterone. Poor sleep can drastically reduce energy, mood, and sexual desire. Nutrition. Include zinc-rich foods, pumpkin seeds, oysters, beef, vitamin D, sunlight, or fortified foods, healthy fats, avocados, olive oil, fatty fish, and antioxidant-rich fruits and vegetables to support hormone function. Stress management. Chronic stress raises cortisol, which can suppress testosterone. Practices like meditation, breathing exercises, journaling, or even a short walk in nature can lower stress naturally. 3. Mindful medication management. If a medication is affecting your erections, you don't have to suffer in silence. Track your symptoms and discuss them with your doctor. Sometimes timing doses differently. Switching to a different drug or lowering the dose slightly can minimize side effects without compromising treatment. Avoid abrupt changes on your own. Your safety is the priority, and a doctor can help balance health goals with sexual vitality. 4. Nutrition and supplements to enhance circulation and desire. Certain natural compounds have shown promise in supporting sexual function. L-arginine, an amino acid that helps the body produce nitric oxide, improving blood flow. Citrulline, found in watermelon and supplements, it boosts nitric oxide levels and circulation. Antioxidants, vitamin C and E, and polyphenols in berries and dark chocolate protect blood vessels and improve overall circulation. Omega-3 fatty acids, found in fatty fish, walnuts, and flax seeds, these support cardiovascular health, which directly impacts erections. 5. Mental and emotional support. Sexual health is not just physical. Medications that affect mood or energy can also impact desire and confidence. To address this, mindfulness and connection. Stay present during intimacy rather than focusing on performance. This reduces anxiety and enhances satisfaction. Counseling or support groups. If medications are affecting mood or libido, talking with a therapist or joining a men's health group can help maintain mental well-being. Daily rituals of confidence. Small habits like dressing well, grooming, or engaging in enjoyable hobbies boost self-esteem, which can indirectly improve sexual performance. 6. Small daily adjustments. Consistency is more powerful than drastic changes. Move a little every day, even if it's just a 10-minute walk after meals. Drink enough water to support circulation and energy. Avoid excessive alcohol or processed foods that can blunt blood flow. The key takeaway: while medications can impact erections, your body has remarkable resilience. With thoughtful lifestyle adjustments, natural nutrition, stress management, and open communication with your healthcare provider, you can preserve and even enhance sexual health. These strategies aren't just about erections, they're about energy, vitality, and confidence in every area of life. Remember, your sexual health is a reflection of your overall wellness. By understanding the impact of medications and taking natural steps to support your body, you reclaim control, confidence, and energy. Start small. One walk, one nutrient-rich meal, or one mindful moment. And build from there. If you found this video helpful, make sure to subscribe to Heal Naturally for more insights on reclaiming your strength, focus, and vitality, all through natural, simple, and sustainable methods. Take care of your body, honor your health, and stay empowered. You've got this.